Ma'am, good morning po. I am Vanessa Valdez, student nurse for today po. May I know your name po?
Maria Elisa Daliente.
Birthday po, ma'am.
August 30, 2004.
Age po.
17.
So, ma'am, before we start po, ano po yung name na gusto niyo po i-address ko po sa inyo?
Elisa na lang.
Okay po, ma'am Elisa, pwede po bang malaman kung anong language po yung gusto niyo gamitin natin for the assessment?
Tagalog.
So, may Tagalog po. So, ngayon, ma'am, ang gagawin ko po muna is to conduct an interview po for subjective data po. So, una po, ma'am, nakakaranas po ba kayo ng difficulty in breathing? Chest pain po. Sa ubo po ngayon, ma'am, may nararamdaman po ba kayo ubo ngayon?
Wala.
So, for respiratory problems po, meron po ba kayo nun, ma'am?
Wala.
Previous thoracic surgery po. Biopsy. Meron po ba kayong allergies?
Wala.
Sa pulmonary study test po, meron po ba kayong x-ray or nag-x-ray po ba kayo for the past months?
Nag-tip.
Skin test po. Influenza immunization?
Wala.
So, for the family history po ba, meron po ba kayong alam na family disease?
Wala.
Okay, wala. Sa use of tobacco products po, ma'am, gumagamit po ba kayo? Okay, ma'am, good to know po. Sa exposure po sa second-hand smoking, meron po, ma'am, nakakaranas po kayo, naka-apekto po ba to sa breathing niyo? Or nagkaroon po ba kayo ng sakit? Meron po ba kayong difficulty in performing daily tasks po?
Wala.
Sa degree of stress po, ma'am, nakakaranas po ba kayo ng stress?
Hindi po.
Bakit po, ma'am? Bakit po kayo nakakaranas ng stress?
School works.
Sa school works, nakaka-apekto po ba ito sa paghinga?
Hindi na po.
Okay po, ma'am. Good to know po. Tapos, meron po ba kayong medication for breathing?
Wala.
Okay po. Thank you po. So, for today, ma'am, I will be conducting an assessment po sa inyo po. I'll be conducting an assessment po to your thorax, specifically to your posterior thorax and your lungs. Then, I will need to inspect, palpate, percuss, and also take or listen to your breath sounds po. Rest assured po na all of the findings and the documents will be confidential between me and to the physician where I will be referring you to po. Is it okay po ba?
Yes.
Thank you po. So ngayon po, ma'am, I will do hand hygiene po. So ma'am, after doing hand hygiene po, I will provide po for your privacy po, ma'am. Ngayon po, ma'am, I will ask you po to change to inpatient gown po, ma'am, para po makapag-assess po tayo ng maayos. Now, after performing hand hygiene, providing privacy for the patient, and allowing the patient to change into her patient gown, I will now start to assess the posterior thorax of the patient. For the first step, I will start for the inspection. First, I will inspect for the shape, configuration of the chest wall, then for the position of the scapula, then for the accessory muscle, and lastly, the posture of the patient. So, ngayon po, ma'am, pwede po ba kayong umupo ng diretso po, ma'am? Then, lagay niyo po yung kamay niyo sa lap niyo po. So, ngayon, ma'am, pwede po ba kayo mag-inhale, exhale? Inhale, exhale. Isa pa po, ma'am. Isa pa po. Last na po, ma'am. Now, for the palpation, I will palpate for the tenderness, then for the sensation, and for the lesions on the back of my patient. Before starting the palpation, I will put on gloves first. Now I will start to palpate for tenderness, sensation, and to check for lesions on the back of my patient. Do you feel any tenderness or pain po, ma'am?
Wala po.
Now, I will check for the temperature of my patient using the dorsal part of my hand. So for the result, for the scapula, there is no protrusion and the scapula is symmetrical. Then for the shoulder and for the scapula, it is equally horizontal to the posterior back. Then there is no sign of kyphosis, scoliosis, or any misalignment of the spinal cord. When I ask the patient to breathe, I observe that she uses her shoulders as an accessory muscle while inhaling and exhaling. Then for the temperature, it is equally bilateral, especially when I touch the patient's back using the dorsal part of my hand. And the temperature is warm, it is not too hot, or she doesn't feel cold to me. Now for the palpation of the premitus. In palpating the premitus, I will use the ulnar part of my hand and I will ask the patient to say the word 99. Now ma'am, while I'm checking po for the premitus po, for palpating the premitus, can you say the word 99 po? Hindi po sabihin yun, ma'am. So, ma'am?
99.
Again po?
99.
Again po, ma'am?
99.
Again po?
99.
Isa pa po?
99. 99.
Now, for the palpation of the chest expansion, I will put my thumbs on the T9 or T10 of the patient. Can you inhale, ma'am? Exhale po. Isa pa po, ma'am. Last po, inhale. Exhale. Now, for the result, for the premitus, it is symmetrical, and when I palpate the patient's back and ask her to say 99, there is vibration on both sides of her back when I palpated it. Now, we will proceed to percussion, and as you can see, I already removed my gloves before we will perform the percussion. First, I will be percussing the intercostal spaces on the back of my patient. Now I have observed for the resonance dullness and for the flatness on the back of my patient as I percuss it. Then now I will proceed to the percussion of the diaphragmatic excursion. So, ma'am, can you inhale po? Exhale. Again po, ma'am. Inhale, exhale. Again. Ito po, ma'am. Now I will get a ruler and a marker to mark it. So, ma'am, can you inhale and exhale po? Again. Again po, ma'am. Last one. Now for the auscultation part, I will auscultate for the breath sounds of my patient and I will observe for any presence of abnormal breath sounds. Now I will be using my stethoscope to auscultate my patient. Ma'am, can you inhale, exhale po? Inhale. Exhale. Inhale po. Again. Again po. Inhale. Exhale. Yan po, inhale. Exhale. Now, I will be auscultating for the voice sound in the chest wall of my patient. First, I will conduct the bronchophony and I will ask her to say the word 99 while I'm auscultating a part of her back. Ma'am, can you say 99 po?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Now, I will ask her to say the word letter E for the assessment of egophony. So, pag naramdaman niyo po yung stethoscope ko po sa likod niyo, pakisabi po yung letter E. Okay po. So,
E. 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 E.
okay. Now, for the whispered pectoriloquy, I will ask the patient to say the phrase 1, 2, 3. Ma'am, pwede po bang pakisabi ng 1, 2, 3 pag naramdaman niyo po yung stethoscope ko?
1, 2, 3.
Yan po, ma'am. Laban lang po.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Now, as I auscultate for the beat sounds of my patient, I haven't heard any adventitious sound or any abnormal breath sounds. I also haven't heard any crackles or wheezing or any pleural friction rub. Ngayon po, pwede na po kayong magpalit po sa clothes niyo po. Now, after performing the assessment, I will do a hand rub or we can do a proper hand washing. So for now, I will do a hand rub. And after that, make sure to make necessary referrals. So, ma'am, wala naman po akong nakitang abnormalities po sa naging assessment po natin sa inyo. And yun lang po, ma'am. Thank you po. Thank you po.